So Paul, many of us are familiar with the signs of a heart attack. We've heard about
Heart attack,
those.
the pain,
And it's different for men than women. Women might have back pain. So the signs of a stroke are very, very different indeed.
Yeah, they say sometimes it's just like you might not even know right away what's happening to you.
Or recognize it.
Yeah, or recognize it.
So we're going to talk about that tonight with Stacia Matthews. You may have heard the name. She's been in the news industry.
I may have worked with the name.
You did. So find out the signs of stroke and what happened to her. We are here with Dr. Carboni and also Rachel, who is your physician's assistant.
That's right.
We're here to talk about strokes. It can happen to anyone, any age, right?
Any age, any time from a child all the way to an octarian, all the way to someone greater than 90 years old.
What are the risk factors?
Cholesterol, high cholesterol is a risk factor. Smoking is a risk factor. High blood pressure is a risk factor.
Well, we've come a long way. What are the things that you do as a doctor to help someone come back from a stroke?
So we try to reduce some of these risk factors that we're talking about. So we make sure that, we follow what the neurologist would like us to do. For example, after a stroke, people are typically on an aspirin a day. And that's a category of a drug that kind of thins your blood enough so that you won't have it. It would lower your risk of having another recurrent stroke. And we try to stress how important it is to follow these medications and don't let your medicines run out. Always get your refills. And if you're having problems with the financial burden of medicines, let your physicians know, because there's a lot of things that we can do. We also make sure that our patients are on a moderate to high intensity statin. In order to help reduce the risk of having another stroke.
Let's talk with Rachel about the signs of a stroke. I'm not sure people are familiar with what those signs are.
Yes, so the easiest way to remember signs of stroke is the acronym FAST. What that stands for is the F is facial droop, the other one is arm weakness or leg, the S stands for speech difficulties or slurred speech, and then the last one is T is time. How important time is to actually call 911 if you're having these symptoms. Go to the hospital, get to an ER, don't go to bed. You need to be seen by a medical professional right away.
Is there a window of time where it's just too late?
I wouldn't say too late, but there is a window of time when there are certain medications that can be given that could alter your recovery. And usually that window is about 3 hours, depending on the type of stroke you have.
Okay, fast. So I know you treated Stacia Matthews. Tell me about that particular situation.
Stacia had the bleeding type of stroke, which for her presented as a very weird headache. For others, it can be a very severe headache. When Stacia came to us, she was physically doing pretty well for herself. A lot of her issues were with her vision and her awareness of what had happened to her, her memory, her ability to problem solve and do complex thinking skills, things like that. So we really focused on that with Stacia while she was here, because she was a very independent woman before and we wanted to get her back to that.
So for a 1 month period of time
I did
in
not
your life,
know. I have no recollection
no
of
recollection. Your sister told you what happened.
it. Yes.
Okay.
And she told me I had a hemorrhagic stroke.
Your sister, what'd she do when obviously you started
I mentioned that I had
that weird headache?
I said, man, this is just the strangest headache. And she told me, as many people do, take an aspirin, go to bed. I'm glad I didn't do that.
What did you do? I know you don't remember.
She told me I woke her up and said, I need you to do me a favor. Please don't let me put my head down, don't let me fall asleep, watch for slurred speech, call an ambulance. I think I'm having a stroke.
If you were to tell our audience something about this journey, what would you like to say?
Know the signs. Know the signs. The doctors mention those signs. Know what they are. If you see someone acting strangely, maybe unable to put a fork in a plate or trying to reach for a glass and they're unable to reach it, that could be a stroke. You don't know. Do it anyway.
Pay attention.
Better to be safe than sorry.
Always.
Yeah, absolutely. But know your signs. Know what a stroke is. Know the signs and react. Do not put it off to say, I'll just take a nap and I'll sleep this through. No.
Because it'll save your life.
It could
Saved
save your
yours.
life. It saved mine. Absolutely.
We are here with Stacia Matthews. I'm Julie Patterson for Boomer TV.